Very well, as we continue to give you some coverage of how the COVID-19 has evolved into this country. Well, let's move on where 12 months after the pandemic hit the country, donning of face masks in public spaces, hand washing, frequent sanitizing and social distancing is now considered basic. However, the implications to the drastic change of life has presented new realities such as an increase in gender-based violence, teen pregnancies and mental health ailments. Nancy Okware takes a closer look at how the pandemic is not just a health issue, but also a social concern that is worrying a psychologist as Kenyans exhibit signs of fatigue.
A majority of Kenyans held on to the hope that the COVID-19 restrictions would quickly pass and they could resume their routine and mingle freely. 1 year later, there has been no significant change. It would appear a majority of Kenyans are experiencing fatigue from constant donning of face masks in public places. They are also jittery on the directive to avoid crowding and limiting the number of people attending social gatherings. Frequent temperature checks before entering any establishment, hand washing or sanitizing are part of the directives that Kenyans have to contend with. If found to have a high temperature, the management has the reservation to deny one entry. The dusk to dawn curfew has also increased the frustration as night travel and the nightlife is curtailed, with families expected to be home earlier. Hundreds of thousands have been rendered jobless, while those who manage to stay in employment have to adjust to remote work or working in shifts to minimize crowding. Physical meetings have been reduced and virtual meetings embraced. It is this drastic change in life with no end in sight that psychologists say is taking a toll on Kenyans' mental wellness.
When people were removed from their normal activities of daily life, going to work, going to school, going shopping, out to exercise, when we were disrupted, all of us in different ways by the virus, the levels of stress at the national level went extremely high.
According to the Ministry of Health, following the onset of the COVID-19 pandemic, there was an increase in the number of domestic violence cases reported. This has been attributed to families forced to spend more time indoors and job losses that have strained the family unit.
The violence that took place between individuals at home and at work and other places, I think was a direct result of the disruption that was experienced from the little babies who were at home to the old grandparents who could not be visited by their children because that was the instruction from the police. Not visiting your parents was the act of loving them, which is a total contradiction. Not burying your loved ones and not going to church was an act of worship.
With the number of Kenyans already appearing to have lowered their guard at a time when the country is battling the third wave of infections, the government is cautioning against fatigue in adhering to these measures.
It is at this time, when we feel the way we feel, that we can let our guard down, adopt a don't care attitude, that then we will be hit hardest.
So let's keep observing them, because there is nothing as important as health. You cannot do much when you are actually, if your health is compromised. You can't. Yes. And COVID actually compromises somebody's, a quality of life.
Some of the interventions the government has put in place to improve the mental health of Kenyans during these difficult times include establishment of a toll-free number where Kenyans can call in for counseling services. As it is, the vaccine is now in the country and there is hope of quickly developing herd immunity. But in the meantime, Kenyans have to exercise patience and adopt to the new way of life to keep safe and survive the pandemic. Nancy Okware, Channel 1 News.